We actually presented a retrospective real-world analysis on the clinical utilization and outcomes of the combination of hypomethylating agents and venetoclax in patients with myelodysplastic syndrome. So, hypomethylating agent along with venetoclax is currently approved for the treatment of patients with AML who are unfit for intensive induction chemotherapy, and it has shown really good results in their patient population. Currently, there are ongoing randomized clinical trials that we are waiting for results on in terms of utilization and the role of a BCL2 inhibitor venetoclax in combination with hypomethylating agents in patients with MDS. So the phase 3 Verona study is currently investigating azacitidine venetoclax versus azacitidine in high-risk myelodysplastic syndrome patient population, and we are waiting for those results. However, due to the high unmet clinical need for this patient population, many centers have started using that regimen at this point of time for patients with myelodysplastic syndrome. So what we wanted to do is basically look into the real-world utilization pattern and the outcomes of utilizing venetoclax in combination with hypomethylating agents, either in the newly diagnosed high-risk MDS setting or in the relapsed refractory MDS setting, to understand the clinical efficacies and the toxicity profile. So this was a multi-center analysis of retrospective nature, and we included about 13 academic medical centers, and we queried the database to actually identify patients with intermediate high or very high risk MDS by IPSSR who were treated either with a hypomethylating agent along with venetoclax or hypomethylating agent alone. And we tried to stratify this patient population into three different cohorts. One was a cohort called upfront hypomethylating agent venetoclax cohort, where patients received hypomethylating agent and venetoclax together as a combination for frontline management of MDS. That included about 175 patients. We had another cohort for whom hypomethylating agent was the starting therapy, and either after lack of response or disease progression, venetoclax was added as a salvage therapy. We call that as post-hypomethylating agent failure venetoclax cohort, and that had about 83 patients. We also had a cohort of about 196 patients who primarily received upfront hypomethylating agent monotherapy. And we compared the clinical characteristics and outcomes across these three patient populations. So overall, we had a sample size of about 454 MDS patients, 258 of whom actually received venetoclax in combination with hypomethylating agent, and 196 patients received hypomethylating agent as monotherapy. So this is a higher risk patient population. Median age was anywhere between 66 to 69 years. Majority of the patients had MDS with excess blast. They had high risk or very high risk disease by IPSSR, and about a third of patients had deletion 17p or TP53 mutation. And venetoclax, what we found was predominantly started in the outpatient setting, and patients had been treated on appropriate tumor lysis syndrome prophylaxis. The doses of venetoclax used range anywhere between 70 milligram to 400 milligram, adjusted for the concomitant antifungal use. What we found that the regimen was relatively tolerable. There were no evidence of major significant side effects that were noted. In terms of tumor lysis syndrome, no tumor lysis syndrome was observed in 92% of patients. Only lab tumor lysis was observed in about 6.2% of patients, and one patient with clinical tumor lysis syndrome at the time of data cut. Neutropenic fever was the main adverse event that was noted in this patient population. What we also noted was actually that the response rate was significantly higher in patients treated with hypomethylating agent venetoclax as compared to hypomethylating agent therapy alone. But again, this is not a prospective randomized comparison, it's a retrospective analysis, so we'll have to take that in terms of the limitation of the data set that is available at this point of time. We also did multivariable models where we looked into event-free survival and overall survival in this patient population, and what we found was the combination of hypomethylating agent and venetoclax improved the event-free survival significantly as compared to hypomethylating agent. There was a trend towards improvement in overall survival, but it did not reach statistical significance at the time of data cut in this analysis. So this is an ongoing study. We have more updates onto the data that are currently being made at this point of time. And I think we'll have more information come once those data is analyzed, but it's an interesting amount of data that we have at this point of time.